In a bestseller book, Outlive: The Science and Art of Longevity, Dr. Peter Attia, a physician specializing in the science of longevity, offers an insightful and data-driven exploration into how individuals can extend not only their lifespan, but also their health span, the number of years they live in good health. Drawing from cutting-edge research in fields such as preventive medicine, metabolic health, neuroscience, and gerontology, Attia presents a holistic strategy for managing the most prevalent chronic diseases that threaten long life: cardiovascular disease, cancer, neurodegenerative disorders, and metabolic dysfunction. Chapter 1. Introduction to Longevity: Healthspan versus Lifespan. Attia introduces the concept of healthspan, the period during life when we are free of chronic diseases, versus lifespan, which is simply how long we live. He argues that modern medicine is more focused on extending lifespan without considering how long we can maintain good health. Preventative focus. He advocates for a proactive approach to health, where the goal is to prevent chronic illnesses like cardiovascular disease, cancer, and neurodegenerative conditions before they become symptomatic. Chapter 2. The 4 Horsemen of Death. The 4 horsemen Attia refers to are the top 4 killers: cardiovascular disease, cancer, neurodegenerative diseases like Alzheimer's and Parkinson's, and metabolic dysfunctions like diabetes. These diseases share common modifiable risk factors such as inflammation, oxidative stress, and insulin resistance. Cardiovascular disease. Attia emphasizes the importance of early detection of subclinical atherosclerosis, or artery stiffening. According to research, coronary artery calcium scoring is a powerful predictor of heart attack risk, and could be used to target high-risk individuals earlier. Cancer. Attia discusses lifestyle and genetic predisposition, but also cutting-edge immunotherapies and early screenings such as liquid biopsies, which detect circulating tumor DNA for early cancer detection. Neurodegenerative diseases. Recent advancements like biomarkers for beta-amyloid and tau proteins offer earlier detection of Alzheimer's, providing a window for earlier intervention. Chapter 3. Exercise, the most powerful longevity tool. Exercise as medicine. Attia argues that physical activity is the most effective intervention to extend both lifespan and health span. He specifically focuses on strength training and aerobic capacity as the cornerstones of fitness for longevity. Strength training. Research supports that muscle mass and strength are critical predictors of aging outcomes, particularly because they prevent sarcopenia, or age-related muscle loss, and osteoporosis, or bone loss. A study from the American College of Sports Medicine showed that resistance training helps maintain functional independence in older adults. Cardiorespiratory fitness, VO2 max or maximal oxygen uptake, a key indicator of cardiorespiratory health, has been linked to reduced mortality rates. Studies show that individuals with higher VO2 max scores tend to live longer. Chapter 4. Nutrition and Longevity. Attia argues for a personalized approach to nutrition, tailoring diets based on metabolic health and insulin sensitivity. He discusses the benefits of intermittent fasting, low-carb diets, and ketogenic diets. Intermittent fasting, or IF, which involves alternating periods of eating and fasting, has been shown to improve insulin sensitivity, reduce oxidative stress, and promote autophagy, or cellular repair. A 2019 review in the New England Journal of Medicine found that IF is associated with longevity and reduced risks of age-related diseases. Low-carb and ketogenic diets. Low-carb diets reduce insulin resistance, a common precursor to metabolic syndrome and type 2 diabetes. The Verta Health study showed that a ketogenic diet could reverse type 2 diabetes in many patients without the use of insulin. Chapter 5. Sleep and Stress. The Silent Killers. Attia emphasizes the impact of chronic stress and poor sleep on aging. Stress increases cortisol levels, which accelerate aging by damaging cells. Sleep deprivation negatively affects metabolic health, brain function, and longevity. Cortisol and stress. Chronic stress leads to increased cortisol, which promotes inflammation, insulin resistance, and even brain atrophy, particularly in regions like the hippocampus, which is vital for memory. Research from Harvard Medical School indicates that mindfulness and meditation can lower cortisol levels and mitigate stress-related health risks. Poor sleep is strongly associated with higher rates of heart disease, obesity, and diabetes. A study published in Science shows that during deep sleep, the brain undergoes a cleaning process that removes beta-amyloid plaques, which are linked to Alzheimer's disease. Chapter 6. Preventing metabolic diseases. Insulin resistance is at the heart of many chronic conditions, including type 2 diabetes, obesity, and heart disease. Attia emphasizes the importance of regularly monitoring fasting insulin levels, which can detect metabolic dysfunction years before diabetes is diagnosed. High levels of circulating insulin and glucose are associated with increased risks of cardiovascular diseases and neurodegenerative conditions. The Diabetes Prevention Program, or DPP, showed that lifestyle interventions, diet and exercise, reduce the incidence of type 2 diabetes by 58%. Continuous glucose monitors and tests for HbA1c, a measure of long-term glucose control, provide powerful tools for identifying metabolic problems early. Chapter 7. Advances in longevity science. Pharmacological interventions for aging are on the rise. Attia discusses promising drugs like metformin, which has shown potential to slow aging-related diseases, and rapamycin, which may extend lifespan by inhibiting the mTOR pathway. Originally a diabetes drug, metformin has been studied for its effects on reducing cancer risk, heart disease, and cognitive decline in non-diabetics. The TAME trial, targeting aging with metformin, is ongoing and may provide more definitive evidence. mTOR is a protein complex that regulates cell growth and metabolism. Inhibiting mTOR via rapamycin has been shown to extend lifespan in animal models, and early human trials show promise for reducing age-related decline. Chapter 8. Mental Health and Cognitive Longevity. Attia discusses how maintaining cognitive function and emotional well-being is essential for longevity. He highlights the role of exercise, social connections, and intellectual stimulation in preserving mental health. Studies show that individuals who engage in mentally stimulating activities, like learning new skills, puzzles, or social interactions, have a lower risk of cognitive decline and dementia. Aerobic exercise has been shown to increase BDNF, brain-derived neurotrophic factor, which supports the survival of existing neurons and encourages the growth of new neurons, particularly in the hippocampus. Conclusion: integrated approach to longevity. Longevity requires an integrated approach. It's not enough to focus on just one area. All components, physical fitness, mental health, sleep, nutrition, and stress management, work together to create a long and healthy life. Attia concludes that we should aim to live longer, healthier lives by combining the best available science and individualized strategies to extend both lifespan and health span. The lesson from Outlive is clear. A proactive, preventative, and integrated approach is key to living well into old age.